Yes, I have experienced racism analysis with the doctor here and nurses. Nurses treat us differently. My file, every time I go there, like I'd be there before everybody, and I thought it's first come first serve. But my thing would get my file would get put to the bottom. I'd have to wait there all day, and it's I'd be trying to talk to one of the nurses or talk to the doctor. Then they'd tell me, go sit down, like telling me to go sit down like a child. I'm not a child, and then not wanting to speak to me, and then I see someone goes up right after me, like another patient, and they talk to one of them right away, and like they tell me they're busy, and that's with the doctor and nurses that they do that. Well, for one thing, I'd like a different doctor, plain and simple, a different doctor, and also better training for people skills for the nurses. They seem not to have any people skills. They get grouchy at us. The the woman that sits at the desk that takes some names and sets us up, she gets grouchy with us. When I was there 2 weeks ago, I heard her swear and say effing natives. I heard that. I was sitting right there in that chair. She kind of whispered it, but I heard it. I heard it clear enough to make out effing natives.
Well, I know when my mother was in the hospital, she had diabetes and she had, like I said, heart, kidney, and lung problems, and she was in there in the hospital for about a month or maybe even 2 months. And when I went to visit her, she didn't have no sheets on her bed. They told me that she was on a mattress that didn't need sheets, but when they finally came to check on her, it was not that kind of mattress. And my mother wouldn't say anything. She wouldn't make any kind of fuss. She just laid on the rubber mattress, and that's it.
I'm a diabetic, and the one you're talking about, he likes touching women. He even done that to me too. And I used to wonder, is that possible for a doctor to do that? Eh? He slipped his 2 hands into my panties, but didn't touch my private. He done that from the back to the front. Eh? Boy, I was amazed, and he just threw himself on the chair after he done that, and he was just blushing, just red. Eh? I just about swore at him, but then again he might charge me. I should have swore at him at the time. I tell him the same thing what I experienced with him. Are they going to do anything about it? Like that. The time I broke my knee, and then when I was there for 5 days, and the nurse was coming to give me fours, and then I told her, can I get a Tylenol extra strength instead of it? She got mad at me, and she went back to where she keeps her pills to come and give me that Tylenol thing. And she holds my lips and then puts that pill into my mouth roughly. And I told the other nurse to put my leg on that pillow. She lifted my leg, put that pillow there, and just dropped my leg. I was just being treated. If I was able to walk, I said I would have walked out of there. And I told my auntie, though, she gets the same treatment.
Well, a lot of old elders don't feel safe there. Like from as I see elders when they're in the hospital. Like when I go up there from that time, I talk with them. They don't feel safe. They look scared, but they don't want to say anything. But they look scared, and you can feel that on them. And that shouldn't be these are our elders. They shouldn't be feeling scared like that. That's a place they should feel safe.
Kinds of things should happen. We should have proper diagnosis. We should have First Nation people at the doctor's office, the drugstore, throughout the system there. We should have a place for concerns to be heard, anonymity, and also online questionnaires or something to that effect where a person can actually just sign in and say this is what happened to them.
He's the only doctor we can see, so like what if we're really sick one time and he doesn't want to give us treatment because of that? And he will do that.
And that nurse there, that receptionist at the hospital, she used to be very friendly with me. Now I'm mad to her, I guess. For what, I don't know. You should see the way she treats them, eh? Very negative and looking angry. I just about told her the last time, why don't you quit your job if you don't like working for Indians? I will do one of these days.